Bruxism is just our term for the habit of clenching and grinding your teeth at night. And there's some people who carry on this habit during the day also, but most of the damage is done at night when we're not under conscious control of it. We're not exactly sure why people do this. There's about a third of the population that has this habit. It seems to be something deep-seated in the brain that encourages the body to do this. But it can have severe damage that comes from it. People literally grind their teeth flat. Now, teeth are made of the hardest structure in the human body, enamel. Yet we'll see people who literally put so much force into their grinding at night that they'll wear the teeth absolutely flat, leading to very sensitive teeth, very unattractive teeth. It can loosen up the teeth. It can create all sorts of problems that way. And even those who don't tend to do the grinding, do the clenching, usually create other type of problems. These are people who overstress the muscles. They overstress the joints. So this is a typical cause for TMJ problems, is this clenching habit. We treat bruxism usually with a night guard. That's the least invasive way. The whole idea of the night guard is that if we can't stop you from clenching and grinding your teeth, if we can't turn that switch off, then we can mitigate the damage that it's doing, decrease the forces involved. So we use a night guard, something like an athletic mouth guard that we have you wear at night. It allows you to only touch with the very front teeth, prevents the back teeth from coming in contact. So this does one of several things. One, if the teeth don't come in contact, you can't create any damage. They won't wear away if you can't bring them together. You're still touching with the teeth in front, but there's a curious little reflex there that we're making use of, that when only the very front teeth touch, your muscles cannot bite down, they cannot contract as hard as they can when you're biting on your back teeth. One of the ways you can demonstrate this for yourself is to actually bite down on your back teeth and to actually feel your temporal muscles bulging out. So if I place the pin in here and bite down, you can feel these muscles bulging right there. This is something anybody can try and do. You place that same pin on just your front teeth and bite down as hard as you can and feel for those muscles bulging. You won't feel them coming out because just that protective reflex right there will decrease the contraction intensity. You cannot bite down as hard. So by use of this night guard, what we've done is prevent tooth-to-tooth contact in the majority of the teeth. Where they are contacting, we've decreased the muscle force by 50 to 75%. This takes a lot of force out of the systems, brings you back down into your adaptive capacity to allow everything to heal, allow the joints to adapt, allow the muscles to relax, the pain can go away. I'm part of a general dental practice, so we see everyone who just comes off the street. We're not specialists. We find that the simple night guards will treat 80% of the TMJ cases very effectively. So we can relieve pain, make people feel better, function better, be able to chew better with just a simple night guard. Now there are going to be about 20% of the people in which there are complex problems there, in which then we would need to refer them off to a pain specialist. But we can do quite a bit with this simple appliance.